Effective methods to restore the sense of smell when losing smell. 1. Olfactory training. Principle: stimulate the olfactory nerve to regenerate and improve the ability to recognize odors. This method has been widely studied and is effective for loss of smell due to viruses, especially after COVID-19. How to do it? Choose 4 strong, recognizable scents, usually using essential oils or natural materials: lemon, clove, rose, eucalyptus, or coffee, cinnamon, garlic, vanilla. Twice a day, morning, evening, smell each scent for 20-30 seconds, focusing on visualizing that scent. For example, remember the smell of lemon when drinking lemon water. Rest 10 seconds between scents. Change the scent every 12 weeks to diversify the stimulation. Note: use high-quality essential oils, dilute to avoid irritation. Be persistent for at least 3 to 6 months, because olfactory recovery can be slow. Effectiveness: studies show that 30 to 60% of people who practice improve their sense of smell after 3 months. 2. Keep your nose clear. Rinse your nose with saline. Use 0.9% saline or a neti pot to clean mucus, dirt, and reduce inflammation. Do this 1 to 2 times a day. How to do it? Stand with your head tilted, spray, rinse one nostril, let the water flow out of the other nostril. Repeat on the other side. Steam. Inhale warm steam from a bowl of hot water. Add a few drops of peppermint, lemon, or eucalyptus essential oil if not allergic. Steam for 10 to 15 minutes, 1 to 2 times a day. Helps moisturize the mucous membranes and improve access to the olfactory area. Humidify the air. Use a humidifier in the bedroom, 50 to 60% humidity, to avoid dry nose. 3. Consult a doctor. Determine the cause. See an ENT to check if the loss of smell is due to a virus, sinusitis, nasal polyps, head trauma, or neurological disease. The doctor may recommend a nasal endoscopy, imaging tests, CT, MRI, or an olfactory test. If due to COVID-19, loss of smell usually improves on its own within 2 to 4 weeks, but some cases require intensive treatment. Your doctor may prescribe medication, such as nasal spray/oral corticosteroids, if there is inflammation or swelling of the nasal mucosa, but do not use it on your own. 4. Nutritional support. Supplement zinc and vitamin A. Zinc, 25 to 50 mg a day, found in oysters, red meat, pumpkin seeds, beans. Zinc deficiency is associated with decreased sense of smell. Vitamin A, found in carrots, sweet potatoes, animal liver, supports the regeneration of nasal mucosa. Thermos: consult your doctor before taking supplements, as excess zinc vitamin A can be harmful. Omega-3, found in salmon, chia seeds, helps reduce inflammation and supports nerve recovery. Recommended dose: 1 to 2 bar a day from food or pills. Drink enough water, 2 to 2.5 liters a day, to keep the nasal mucosa moist. 5. Avoid harmful factors. Avoid exposure to cigarette smoke, chemicals, dust, or strong odors, perfume, paint, as they can further damage the nasal mucosa. Limit nasal decongestant sprays, such as oxymetazoline, because long-term use can damage the sense of smell. 6. Other methods, as prescribed by your doctor. Corticosteroids. Inhaled, budesonide, fluticasone, or oral, prednisolone, may be prescribed if loss of smell is due to severe inflammation. Use only short-term, 5 to 7 days, to avoid side effects. Antihistamines. If your loss of smell is due to allergies, medications like cetirizine or loratadine may help. Surgery. Rare, only if your loss of smell is due to nasal polyps or a severe deviated septum. 7. Follow up and be patient. Recovery time. Loss of smell due to viruses, like COVID-19. 70 to 90% improve within 4 weeks, but 10 to 20% may last 6 months or more. Due to trauma or neurological disease, recovery is more difficult, requiring intensive treatment. When to see a doctor again? Loss of smell lasts longer than 4 weeks without improvement, accompanied by symptoms like headaches, nosebleeds, loss of taste, or neurological changes. Keep an olfactory diary. Record which smells you smell, how much you improve, to assess your progress. Important note: do not use strong drugs or essential oils on your own. Some folk methods, such as garlic spray, strong cajeput oil inhalation, can cause irritation or damage to the mucous membranes. Positive psychology. Loss of smell can be uncomfortable, but stress slows recovery. Practice meditation and light yoga to reduce stress. If you lose your sense of smell due to COVID-19, combining olfactory training with nutrition rich in omega-3 and zinc can increase effectiveness. Thank you for watching the video. Wish you and your family health and happiness.